Hello, and on behalf of everyone here at Otska, we hope you are staying safe and healthy. As we navigate the COVID-19 pandemic, we face unprecedented challenges. We all must sort out how we live, learn, work, and stay well in this difficult, constantly evolving environment. Yet some of us face even greater difficulties. People with chronic and underlying conditions are most vulnerable right now, including and especially the mental health community. It is the goal of this project to support people affected by mental illness. We will hear from experts who work as advocates, as well as healthcare providers and people with lived experience. We'll hear their views on resources, tools, and other ideas to support people with mental illness, as well as their families and loved ones. Today, we will be speaking with Dr. Saundra Jane, who is on the U.S. Site Steering Committee, as well as Dr. Saundra Jane, a clinical psychologist who's also serving on the U.S. Site Congress Steering Committee. We're also joined by Dan Gillison, who is the CEO of the National Alliance for Mental Illness. Finally, Michael Pollack, who is the president and CEO of the Depression Bipolar Support Alliance, or DBSA. Rakesh, let me start with you and ask you a couple of questions. You're a psychiatrist, and what are the most pressing questions and concerns that people have right now, and how are you responding to them?
Yes, be happy to talk about that, Mary, and greetings to you and to everybody else who's part of this endeavor. Well, obviously I'm a psychiatrist, as you said, but I also am a citizen of this country, so I'll give you perspectives from both ends. And what I'm seeing is, of course, hundreds of thousands of Americans who have been affected by this virus and are very sick. Many of them are mental health professionals, and of course, thousands have died. But there is another pandemic that's evolving in America right now, and that's the pandemic of fear and the pandemic of stress. And I think that is affecting perhaps 99% of our citizens. So, Mary, what I'm seeing is a global pandemic of concern, fear. People are worried about their health. They're worried about their family members' health, their patients' health. They're worried about what will happen to society. While they're so afraid of physical illness, I think what they're really talking about is how genuinely concerned they are about where their mental health is, where it will be, how will they cope with it. If they already suffer from depression and anxiety, we're watching these poor individuals really suffer. So how am I coping with it? Obviously, I went through all the stages that perhaps everybody else did. The first was complete disbelief. This is an exaggeration. The second was, oh no, it's coming to get us, and it's all finished, sort of thing. But now that the shock has worn off, I think I'm at a place where it may be more fair balanced. I have concerns, and I'm telling people have appropriate concerns, but live your life. And life involves not necessarily going for a drive or going to the grocery store. Those are important things, but life really involves having a wonderful life, or as best as you can, between the 2 ears of your body, which I am called, obviously, that's mental health. So I'm asking people and myself, there are many things you can't control, but there are so many things you can. You really can control, for example, your optimism. You can control your resilience. You can work on that. You can control social connectedness. Sure, face-to-face can't happen, but what we're doing now is actually very meaningful to me. Those are things you can control. You can go out to the gym and exercise, but you can exercise at home. You can do a number of things. So, Mary, my main advice to my colleagues and my family members, and also to the man I see in the mirror every single morning, is you are powerless over a number of things, but you're not as powerless as you sometimes believe.
Thank you for that. I think that's very important for us to recognize, is where we do have some power or some control over, and then exercise those. So Dr. Saundra Jane, let me ask you from a clinical psychologist perspective, what are the biggest issues that people with mental illness and their supporters face during the COVID-19 pandemic and the social distancing that it entails? I mean, this really is beyond the 6 foot, distance. It's really about separating from those of, our loved ones and our families and our colleagues.
That is such a good question, Mary. Before I answer it, I'm so glad to be joined and a part of this call this morning with my colleagues. So thank you for this opportunity. I would say this, in my experience in the practice, talking with my colleagues around the country, I think there are a couple of concerns that really rise to the top. First is access to care. That is probably the first concern that I hear from patients. So it sounds like this: how am I going to see my provider? What happens now? I can't do this on my own. I've been seeing that person every week for 2 years. What am I supposed to do? So access to care is probably top of the list. The other concern, and these are concerns not only for our patients, but for their support group, their families, their friends, their work colleagues. That other concern is an uptick, an increase in things like worry, tension, stress, anxiety. So all of those are rising to the top, so we have to pay attention. 2 more things. Third is sleep difficulties. Now, in our world of taking care of patients with mental health challenges, that's not a surprise. But when you add this fear that is really consuming many of us, it interrupts our sleep. It causes us to lay awake at night and worry. So we have to address insomnia, sleep difficulties. And then finally, what you said, Mary, is right on point. It's about social distancing. We all understand medically why that makes sense, and it's protective for us and those around us. But what the fear is that if I do it, I'm going to be lonely, isolated, and all by myself. And so those 4 things, I think, rise to the top as the main concerns that I'm hearing. So the question for me is, we can point out the concerns, but what are we supposed to do about it? And this is what I think we should be doing, trying to do. First and foremost, we have to provide a space for our patients to talk about their fears and express them fully. We have to listen to them and give them that opportunity. And then we have to jump straight to the resources. We have to educate them. So for example, one thing about access, talk to them about teletherapy, telepsychiatry. Social distancing, the last one I'll comment on is this. To social distance does not mean to be socially isolated. We can educate our patients that we can use all sorts of new platforms to connect. It's just in a different way.